Welcome, everyone. I'm Dr. Enrico Dolcecore, and this week's topic vertigo. This is a common dizzy complaint that I see a lot as a chiropractor. It starts with being dizzy, it can cause nausea. Patients are very upset. It's not a good symptom to have. But we wanted to dive into where vertigo comes from because it seems like there's an underlying condition to it. Symptoms can be across the board. I mean, the spinning sensation is the most common symptom with vertigo, where people say the world is spinning, the room is spinning, or they feel like they are spinning or turning or about to fall. So it's a dizzy type symptom that can happen with vertigo. Can also cause nausea and vomiting because of the spinning sensation. People can get nauseous with it as well. So there's some nausea that comes with it. Sweating. Sweating can happen with vertigo. And again, that's tied with the nausea, feeling nauseous, feeling sick. So these are all symptoms that happen because of vertigo, because of the underlying causes of vertigo. There can be ringing in the ears with this. There can be headaches as well. But that seems to be the most common symptoms that come into our office with vertigo. Now, the question is, well, where is it coming from? What's happening? Why does it happen? It's usually a rapid onset, comes out of nowhere. People may have had an experience, maybe getting off of a cruise ship, being on a boat, motion sickness, seasickness, a long car trip, maybe a vacation. They drive for multiple hours, and they come back feeling, dizzy and sick, and that symptom doesn't go away. They wait a few days, it doesn't go away. Weeks go by, they still feel dizzy. And there's different types of dizzy diagnoses that are out there, and different ways to look at them and to diagnostically find them. But we'll go through a few of them, and maybe you know someone who's in one of these boats, and we're going to get to some solutions as well, what we can do for vertigo. BPPV is the acronym for benign paroxysmal positional vertigo. And that one is the one where people, when they move their head, they feel dizzy certain ways. Maybe they're getting up from a right lying position and they sit up and they feel dizzy. But when they get up from a left lying position and get up, they don't feel dizzy. Waking up in the morning is the worst of it. And then as they move around, they start to feel better. That one can be tied to the calcium carbonate that builds up inside the ear. They're called the crystals. ENT medical doctor will be able to diagnose this when they look into the ear, or with a CAT scan of the head. You can sometimes see the calcium inside of the vestibular capsule, and it shows up as looking like crystals. And as these crystals move, they can cause disruption in the labyrinth, which is the balance center of the brain, and hence give us that sensation of spinning. This accounts up to 50% of all vertigo cases, because it will start, it will happen a few days, maybe a few weeks go by, and patients get better by themselves. Something happened, they moved, they went to see a chiro or PT, they did some head exercises or movement exercises or the Epley's maneuver, and it worked. But we're talking about the other 50% of people that may be stuck with long-term dizziness and vertigo type symptoms. These next few ones are the diagnostic ones, with like Meniere's disease, where the inner ear is affecting the hearing and balance. It may come with a ringing sensation or a dull noise in the ear as well, sometimes tied to headaches, where the vertigo, the dizzy spells, and the headaches are all tied together. This is usually diagnosed down the road after we've exhausted some other diagnostic tests, like looking in the ear, nose and throat, doing a CAT scan, seeing nothing else. Meniere's disease is sometimes diagnosed, especially in the older population. So that's one as well. Vestibular neuritis, that's where the nerve that connects the labyrinth to the brain for auditory sensation is inflamed for some reason. It could be irritated due to inflammation and infection. This one is the one we want to dig deep with. And that's why in our office, we combine chiropractic care and functional medicine together, because we want to look at the blood work. We want to look at neutrophils, eosinophils, leukocytes, make sure there isn't a chronic underlying infection somewhere in the body, which typically infections lie in the gut and in the sinus cavity. That's the two most common areas where chronic infections can be. And it doesn't mean that we're infected, we have chronic symptoms. It just means, well, we do, but it doesn't mean we're sick all the time and with a runny nose and always running a fever. It means that we have a chronic infection maybe causing things like Meniere's disease or vertigo or dizziness or imbalance or nausea. It could be that. So that's why we always combine that. We don't waste much time. We get started with chiropractic care. If we're not getting somewhere quickly, we then look at blood work to make sure we're not missing something that's underlying. With Meniere's, we can get with vestibular neuritis, we can get migraines that come with that as well. And there's a migraine associated vertigo. Once we come on with a migraine, we get dizzy. They go hand in hand. It's a symptom of the migraine. These can be debilitating for a lot of people. To have a migraine is already debilitating enough, and to also have dizzy side effects from it, dear word, that starts to get out of control. Obviously, trauma to the head and neck can cause dizziness. This could be, again, inflammation because of the trauma from a car accident, from an injury, from a slip and fall, whatever it may be. Medications can be another reason, and and we can't ignore that vertigo can be a serious symptom of something deeper. Multiple sclerosis, a possible aneurysm, brain tumor. These are things that we have to rule out. So when we go to a doctor, our primary care, or right off the bat, and we say we've had vertigo or dizziness for a long period of time and it's not going away, right away we go in for diagnostic imagings, MRIs, CTs right off the bat. And those have become very useful for diagnosis for the other conditions as well. But those are mainly sent out to rule out any type of brain pathology right off the bat because we don't want to miss that. And then after that, then we start going down the ladder of what the possible diagnoses are based off of what the most common are. And this is a very common way in medicine and in diagnostics to go down that ladder, no matter what the symptoms are. And what ends up happening, one of the faults to this is that because the most popular ones are usually the case, let's say it's like the BPPV, the benign positional vertigo symptom, where people have crystals in the ear. When we go to an ENT or we go to our primary care and we get the MRIs and the CTs and they're clear for pathology, which is good news, they automatically say, well, this is crystals in the ear. And that can lead you down a road of like weeks to months of therapy trying to figure out how to move these crystals. So you find a provider that might be good at the Epley's maneuver. Please, I would recommend that a physical therapist or a chiropractor trained in the Epley's maneuver. That's probably going to save you a lot of time, because if that exercise doesn't work, it's probably not crystals in the ear. So find someone who's certified or well versed in the Epley's maneuver and does it properly for you so that you can learn how to do it and repeat that. And it should only take a week or two. And as you get better, then we know it's crystals. If not, then we have to go down that ladder and start looking at, is it Meniere's? Is it the neuritis, or what's going on internally? So in our office, we catch the next three rungs in that ladder. Even if it's a benign positional vertigo, we help with that. That's, I think, the easiest one to help with. But the other ones like Meniere's, tinnitus, vertigo, cervicogenic vertigo, positional vertigo, when we diagnose that, then we know what to do from a chiropractic perspective. It comes with specific upper cervical adjustments. There's multiple different techniques of upper cervical that all do very well with Meniere's and vertigo. We use the Blair technique, a low force by hand technique that's used without instruments. And we take a CBCT of the upper neck, which is a cone beam X-ray, a 3D dimensional X-ray that we get. Almost looks like a CT of the upper neck to see the position of the neck and its alignment of all the vertebra. If those are out of line, then they can be causing some neuritis at the brainstem, which can go out towards all the nerves in the head, not just the auditory nerves, but facial nerves, sensory nerves, dermatomes. All these things can be affected with malposition of the upper neck. So that's how we look at it. And by correcting it and getting the spine aligned in the upper neck, the symptoms start to go away. Patients start to feel better. We do post checks. Everything's aligned. They're good to go. That's our success through there. So that's with the upper neck. So that ties us into what we do in the upper neck in chiropractic, and that is how we help people with vertigo. So vertigo is not fun. Not one of these patients that comes in, do I feel like trading shoes with them? They all deal with it. I find them to be so strong. I don't know how they deal with it all the time. Some of them come and say, it's been years. I've been diagnosed years ago with Meniere's or vertigo or whatever it may be. And am baffled. How do you live that long with it? The meds sometimes work, the meds sometimes don't. But you just learn to live with things. And once we find a solution, boy, are they super grateful for this. So this podcast is more of a PSA about if you know anyone that's suffering with dizziness or vertigo, find an upper cervical chiropractor. You just put an upper cervical chiropractor in your town into Google, and you'll start to see the local ones that are there. Do some research, look at the Google reviews, call them up, contact us directly. We know the whole network in North America of upper cervical chiropractors. So wherever you live, we can find you someone close, especially if you want the Blair technique or, a specific technique. We just tap into our network. And if you're in Colorado, I'll contact my two guys in Denver and Colorado Springs. I'll call them up and they'll know the local associates or upper cervical chiropractors that are in Colorado, for example. And I'll get right back to you and be like, hey, Jimmy, this is the one closest to you in Boulder, wherever you may live in Colorado. So we're more than happy to help you find the right people that way. But just go online, always look at reviews and look at the website, and then just do some research for yourself about the technique that you're looking into for upper cervical. They do work. We see so many miracles every single week that's why we do the podcast, is to help people get the awareness out there. So if you're suffering from dizziness or vertigo or nausea, chiropractic is probably going to be something that helps you. And a good chiropractor will guide you in the right direction. If they don't feel like they can help you, they're going to send you to the right place so that you can get the crystals checked, you can get the Epley's maneuver done, you can get a CT or MRI, whatever it may need, to make sure we rule out anything that's underlying to that. Questions, concerns, anything, we're always open for you. Contact us at Living a Full Life Podcast or at www.fulllifetampa.com. Follow us on social media, like, share, do all the good stuff for our podcast to help it keep growing and get to more listeners. Stay healthy, stay well, and take care.